I'm Colonel Sembiso Paul Ciliza, Officer Commanding 7 Medical Battalion Group. I'm here in Richards Bay as part of Exercise Shared Accord as the South African Military Health Services Contingent Commander. We have had a few interactions with the local health authorities over the past few months, trying to get at what priority areas they might have in terms of the disease burden in this area. We've also spoken to animal health specialists looking as well at what concerns they might have in terms of the animals in the area. Now, in terms of our outreach, we have started on the 3rd, looking at certain clinics, visiting them and having our health professionals consult on a primary health care level. We've also started with an oral health education program, but as well as health interventions from an oral health perspective, with some people from the community being bused to our health facility that is here at the Richards Bay Sports Facility, where certain procedures are done, emergency dental procedures, as well as minor cosmetic work that is being done. Now, this is all of an effort that we do to change the perception that people have of the armed forces. Now, we want to make sure that we are seen as an armed forces, as a military for the people, and we really are looking at that human aspect as well. Now, looking at the things that have happened in this country, we really want to make sure that we are visible as much as possible and make sure that our people know that we are the last line of defense for the South African public. We also have a separate component now, having been joined by American personnel. There is a grouping of an American healthcare worker grouping that moves with our people, doing certain assessments from their side. Now, unfortunately, because of certain regulatory constraints, they are not directly involved with the healthcare rollout, but at the same time, they are there to advise as well as to learn from us. Now, multinational exercises are things that happen across the world, and really we do these things to share experiences and be exposed to certain conditions that we might not necessarily see if we are just left alone in our own countries. But it really is a sharing of knowledge and experience with our American counterparts.